Diabetes is a very common condition and impacts more than just the elderly. Many people do not realize that children, young adults, teenagers are also at risk for diabetes based upon things like having a sedentary lifestyle, poor access to nutritional foods, a family history, and other factors. I'm Dr. Meg Tomko, Medical Director at Strides Geneva Clinic. Today I'm joined by Maritza Orozco Reyes, Certified Diabetes Educator and Registered Dietitian at Adams County.
Thank you, glad to be here.
Prediabetes is something that has very little to no symptoms. How would our community know that they could be at risk or that they or their family members should be screened?
The CDC has a risk test that is free online. It's about 6 questions and you can actually take it. And if you score 5 points or higher, you're at risk of developing type 2 diabetes. The other thing is a blood test that can be done at your doctor's office, which is called the hemoglobin A1C. That gives you a percentage and it's an estimate of the last 3 months of how high your blood sugar has been. You are considered to be in the prediabetes range if it's between 5.8% or 6.4%. If you have the diagnosis of diabetes, that would be 6.5% or higher. Prevention is key, and actually getting access to care and being able to get these screenings done is very important.
So we hear, and you've said it already, prevention is key. So what is important about early intervention and what can people do? How can that prevent type 2 diabetes?
A couple of risk factors that go in with that. And so also taking the CDC's risk test, scoring a 5 points or higher on that risk test, we know that there are some changes that need to be made. Type 2 diabetes is a chronic condition that affects our heart, our liver, our kidneys. And so we want to make sure that we are keeping our body healthy before those complications arise. The diabetes prevention program that we have at Adams County called Journey to Wellness can reduce the development of type 2 diabetes by 58%. And that's all done through lifestyle changes, healthy eating, moving more, sleep health, stress levels, right? We discussed that, and heart health.
That sounds like an amazing program, something that would be of huge benefit. So tell us some more specifics about the Adams County Diabetes Prevention Program and how it can help our Stride community.
So first, I would like to say that it's little to no cost to your patients. Second, we offer in English and Spanish. It is 26 hours of education spread out throughout the year. It's also offered in person or virtually and different times throughout the week and actually throughout the day. We have evening classes, which is great, makes it for a lot of working parents.
That sounds fantastic. And just to reiterate again, it's offered in both English and Spanish, which really broadens its reach to the Spanish-speaking community, who does often have limited access to healthcare.
It's very culturally relevant too. So we go take in their foods that they're accustomed to and try to fit it in this healthy lifestyle change.
That really does sound amazing. So my understanding is that this program is offered to people who are 18 years and older. But we know that the prevalence is increasing in young children and teenagers. How can your program benefit the entire family?
Yeah, so these adults are coming in, have children, have grandchildren. So they're bringing all the skills into the home already and having these skills develop in their young children.
Yeah, it's a whole family lifestyle change, so I really appreciate that. Please reiterate for us how our community can get registered for these programs and some of the availability and platforms that they're offering.
Yeah, so they can log into our website. There's a registration link, and that's how you can register for the classes. For those individuals too who already have a diagnosis of type 2 diabetes, we also have another program that's called Diabetes Self-Empowerment. And that teaches them the skills to know how to manage their diabetes, from taking medications and how to do it safely, how they work in the body, healthy eating, exercise, those long-term complications, by having access to those tests and what to look for.
That sounds like you have just a wide range of very accessible and very relevant programs for our Stride community. Thank you very much for coming today and for talking to us about these programs. We look forward to our partnership with you. Thank you for listening.